3 hospitals, 2 counties, and now millions of dollars in tax revenue no longer coming in.
It's a done deal, but we're still going to pursue everything we can legally to get the monies that we feel should be paid to the city.
Tenor Health acquired Commonwealth Health earlier this week, officially taking over General Hospital in Wilkes-Barre, as well as regional and Moses Taylor hospitals in Scranton.
They would have closed last weekend if they didn't come to that agreement.
But with the change in name also comes a change in tax status, as all 3 hospitals will go from for-profit to nonprofit, which means all 3 are now exempt from property taxes.
It's something that's really going to hurt the city of Wilkes-Barre.
Lackawanna-County is going to lose out on more than $3 million a year, $680,000 for the city of Scranton, $1.6 million in school taxes, and just over $1 million in county taxes.
But we're hoping that they are going to be good members of the community and are going to work with us in payments in lieu of taxes.
But that doesn't seem to be the case in the city of Wilkes-Barre.
And when I asked for a pilot, a payment in lieu of taxes, they said, Mayor, no, we cannot pay a pilot to the city of Wilkes-Barre, which means I have to make up that $774,000 in revenue loss.
In Luzerne County, Wilkes-Barre General Hospital accounted for nearly $1.5 million in tax revenue in 2025, including $774,000 for the city, money Mayor George Brown was relying on.
We have other nonprofits that pay a pilot, the colleges. Another hospital in the city of Wilkes-Barre pays a pilot. This hospital and the new ownership said, no, Mayor, we're not going to pay a pilot to you.
Tenor has entered into a pilot agreement with Luzerne County. $850,000 will be paid for each of the next 4 years. But that money is only going to the county. Wilkes-Barre City gets nothing. Do you know why the county may have come out with a different outcome than you have and
Absolutely.
then Lackawanna County has?
The county had to approve the bond structure. The city did not.
Tenor Health says its nonprofit status allows the company to invest in patient care, releasing this statement to Action 16, saying in part, quote, "We've had productive discussions with local officials and remain open to partnering with government leaders in ways that align with our nonprofit mission, while supporting the overall well-being of the region. We are hopeful these collaborative efforts will continue as we work together to preserve access to high-quality care for residents across Luzerne and Lackawanna counties." Lackawanna County says those jobs and services provided by the hospitals were vital to retain.
When it comes right down to it, yeah, we're okay. We're not okay with it, but we're okay with the tax loss so long as we have the health care provided for our residents, for sure.
As officials work to make sure the loss of property tax revenue from the 3 Tenor hospitals does not become a burden for the taxpayers.
I'm going to pursue every avenue I have as the mayor of Wilkes-Barre legally to ensure I do the best job I can in trying to get payment for all the services through a pilot. And I'll pursue every avenue I can legally to do that.
I think the 2 other commissioners feel the same way that I do. We're going to find a way to make up for this, and we're not going to be voting for any tax increase in any time in the near future, that's for sure.
Right now, Tenor has not reached an agreement on pilot payments for Wilkes-Barre Area School District. Wilkes-Barre area received more than $600,000 in school taxes from Commonwealth Health in 2025. A board member telling Action 16 investigates, quote, "It's extremely disturbing to realize that our students and future healthcare workers will have to pay the price for corporate greed. Geisinger and Lehigh Valley Health Network give back to our district in many ways in lieu of property taxes. I'll be interested in seeing what the new owners of Wilkes-Barre General Hospital are willing to do in order to invest in our future." Now, leaders in both Lackawanna and Luzerne counties say they are hopeful they can continue positive conversations with Tenor Health. They hope the nonprofit will invest in bolstering the hospital system and services while also putting in a financial investment in the community.